I'm the chair of the steering committee of parents active in Hammersmith and Fulham, and this is Nandini Ganesh, who is our coordinator. I've been asked to talk to you about some work we did last year around health. Probably the same for all of you. We found a lot of families and carers were experiencing problems with health care. Not so much about the treatment, more about pathways and access to the treatment, and lack of equipment in hospitals, and also some problems with continence pads and wheelchair services. We decided to spring into action and formalise things by doing a survey. And from our short survey, we gleaned a lot of personal stories, and we were able to put together quite a comprehensive report focusing on where the gaps in provision and the poor provision were. We invited our very friendly Children's Health Commissioner to the office and showed her the report. And she rather humbly said that it was a great report, but it was bigger than her and we should be showing it to a much wider audience. And so Nandini booked a room and got on the blower to all the great and the good of healthcare in our borough, plus any other professionals and anyone else who seemed relevant. And we had a huge uptake. And last November, we did an official launch of our report. And instead of our normal format, which would be Nandini and I boring on, we decided to make it a more interactive, personal presentation. And we asked several brave parents to come and give their stories. This was very moving, and they did amazingly well. And the stories were pretty terrible. But they also represented more general problems that were experienced by wider number of people. It was very, very well received, and I think I spotted a few tears in the audience. And by the end of the morning, we actually had various professionals standing up and pledging their support. And Nandini is now going to give you some more detail about the issues in the report and the progress that we've made.
Actually, before I start off, I should thank Sheila Davis, because when we started off the survey, I called her and asked her how to do the survey and what sort of questions should go into it, and she was a big source of help. So if anybody wants to go down that route, please call Sheila. She's brilliant. What did we actually look into the report? And before that, actually, we should show you the report. This is a photocopied report because our report went all over the place and everybody took it away. So this is our report. The thing is, we put the survey on SurveyMonkey, and there were 3 areas we looked at: GPs, hospitals, and other services. And what did we actually seek from the report? What we wanted to actually achieve was for the local health service departments to communicate more effectively with one another with regard to individual cases, and for the local health services to ensure training of all staff in the special needs of disabled children attending healthcare appointments and A&E departments. So we first tackled GPs, and from GPs we wanted better communication, we wanted more training for GPs, we wanted appointments prioritized, we wanted a sympathetic point of contact, we wanted good, accessible out-of-hours appointments, and we wanted all the quality of medicines and referrals to because parents were going to hospitals for simple prescriptions and GPs were refusing to prescribe medicines, and we wanted this rectified. So this is what we surveyed and found in our report. And now where we are at is outcomes we have achieved is our Hammersmith and Fulham CCGs on the verge of signing off training, which is joint training between professionals and parents, to be offered to GPs and surgeries. And this will take care of all the other problems like appointments, out-of-office appointments, sympathetic point of contact, etc. And we are hoping this is at the verge of being signed off, and we hope that they put the signature on paper. Next, we moved on to hospitals. And what we wanted from hospitals was parents and GPs should be copied into all the reports. Some parents found the waiting areas too crowded and staff there very insensitive, especially parents of children with autism. And some parents who needed specialized consultant appointments had a very long gap between 2 appointments. And again, access facilities in hospitals were very poor because some children who wanted the pureed food were not getting it. And children were not showered for 2-3 days in a row because the beds did not have hoists to actually lift the children onto the bathing area. And this is what we highlighted in our report. Again, the problem of pharmacy and medicines, etc., was there. Schools were complaining because many children were missing schools because of too many appointments. And this was affecting the school's Ofsted performance. So where we are at, we didn't achieve everything, but we sort of had some minimum success. We were invited into the Learning Disability Board of Chelsea and Westminster Hospitals and Imperial College Hospital. And we are also working with them on hospital passports. We are getting somewhere, but we have not achieved it yet. We are still tackling that issue. And we hope that getting onto this Learning Disability Board, we can tackle the issue of access in hospitals, changing places, toilets, etc. And there's also a pharmacy coordinator who's promised to come and speak to parents about their issue with medicines, prescriptions, etc. Then we moved on to other services. Other services, again, incontinence pads. We did have a success with that in the sense we changed the quality of pads. But we are also tackling the assessment and assessment process and activation process. We are working on a pathway for that. Wheelchair was a problem, but we successfully achieved that to some extent because there was a survey around wheelchair, and I think they are working on paths was an issue. Paths to the wheelchair was an issue because if a part got damaged, the parent had to wait for a long time for the part to arrive from somewhere and get it replaced. So that is sort of getting tackled now. Again, transitions to adult services is a huge, huge problem for many parents. Because many parents, when they hit 18, we may talk of plans going up to 25, but when they hit 18, they are transferred back to their GP and they have to start all over again. So this is something we are again battling on. And now in Chelsea and Westminster, we've got a point of contact for the parent to go to transition on to adult services. So a bit of success there. And again, therapies is a common problem for all of us, and I don't know how many of us have achieved getting more therapists, speech and language, etc., but that's still ongoing. We are also looking for behavioral support team because CAMS, the Children and Adolescent Mental Health Service, not all children need that, but they need some sort of behavioral support. So we are lobbying our social care services and health for a behavioral support team in Hammersmith and Fulham. I can stand up and say we achieved it all, we've done it all, but we haven't. We are tackling our issues, and we are hoping for a day when we can have another launch to celebrate all what we achieved. But we have made progress. There's a lot of sympathy out there. And our presentation, actually, everybody said it was a master class in disability awareness. Because even if we didn't achieve all what we wanted to achieve, we at least put in the awareness there. And that is, I think that we'll say is a success. And we hope next time when we come here, we can say we've achieved whatever we wanted to, and that is our aim. Thank you.